today. If you see potholes in your area, you can contact your respective public works to report them. In recent years, the stigma around many mental illnesses has improved drastically. But for schizophrenia, the stigma has remained. Schizophrenia is a chronic neurological brain disorder that impacts millions of people worldwide. In many cases, it is treatable. Our Alexa Maslowski brings us a story of one woman who is using her experience to help others.
My name is Bethany Yeiser, and I have been fully recovered from schizophrenia for about 13 years now. But as I often say, this was not supposed to happen.
In high school, Bethany Yeiser had a passion for the violin. She played in the Cleveland Orchestra's youth orchestra and was a member of the National Honor Society.
Looking back, I had a very happy and normal childhood.
After graduation in 1999, she went off to her dream school, the University of Southern California, to study molecular biology. But soon she would begin to experience delusions. After traveling to countries in Asia and Africa, Bethany was set on helping people, becoming a sort of prophet or Mother Teresa-like figure.
I didn't realize that my mind was totally broken, and that the truth was that my best efforts were producing failing grades.
Bethany became homeless during her junior year of college, cutting off contact with her parents and friends. She would sleep in libraries or public restrooms for years.
I thought, when I become a prophet or a politically powerful figure like Mother Teresa, nobody will care that I used to be homeless for a while. I thought being homeless was what it took.
Then came the hallucinations and the voices.
March 3rd of 2007, I woke up one morning screaming back at the voices, which are the most irritating stimuli imaginable. And I was picked up by police, taken to a psych ward for evaluation, and that was the start of a new life.
When doctors told Bethany she had schizophrenia in 2007, she says she was angry, insulted, and humiliated.
I didn't know what schizophrenia was, but I thought it was a mental illness where people did not recover, and I thought that if you had schizophrenia, you'd basically be locked up for the rest of your life.
Today, Bethany is fully recovered from schizophrenia. She found Dr. Henry Nasrallah, who prescribed her clozapine, an antipsychotic that treats hallucinations and delusions. She went on to graduate from the University of Cincinnati in 2011 and published a memoir in 2014. She says clozapine makes her drowsy, so she isn't able to work full-time or drive a car.
So I do have some limitations, but I have a great life. I have meaningful relationships. I have meaningful work. I volunteer. I play violin for my church. I teach piano lessons. I do what I love.
In 2016, Bethany and Dr. Nasrallah started the Cures Foundation, which stands for Comprehensive Understanding via Research and Education into Schizophrenia.
One of our biggest objectives is to reach out to the general public saying, look, this is a disease. It's a lot like Parkinson's disease or Alzheimer's disease. It's a little bit like diabetes, you know? When I take my medication every day and stay in remission from symptoms, I feel like a diabetic who's taking insulin. And once they agree to take insulin every day, they can have a normal life.
She encourages anyone with this brain disorder to fight for the highest quality of life and tells them never to give up.
I do not consider my schizophrenia to be a life sentence. With the appropriate medication and many great conversations with my doctor talking about goals, I've rebuilt my life.
For Spectrum News, I'm Alexa Maslowski.
Joining us now to talk more about the signs and symptoms of schizophrenia is Tiffany Pottkotter, who is a psychiatric nurse practitioner in Findlay. Tiffany, thank you for being with us.
Thanks for having me.
Tell us about how schizophrenia is diagnosed in children and adults.
Well, we use the DSM-5, which is the clinical diagnostic book to diagnose schizophrenia. So we look for a couple different things. The first thing we look for is you must have 2 or more of the following symptoms for at least a month. The first one is delusions. So this could be, unusual or odd beliefs that you hold. Hallucinations, and these can come in the form of visual or auditory hallucinations. Disorganized speech, which could look like mumbling, disorganized behavior, and also negative symptoms, which that would mainly be, social withdrawal or flattening of affect. We also see a decreased level of functioning, and this could take place, work, interpersonal relationships, school, or even in the form of self-care. These symptoms have to be continuous for at least 6 months, and it can't be attributed to another disorder. And you can't be on substances, because if you're on substances, a lot of times these can also mimic the same symptoms as schizophrenia.
Are there risk factors or triggers for schizophrenia, such as hereditary factors or substance abuse?
Sure. So there's still a lot we don't know about the cause of schizophrenia, but what we do know is it's probably multifactorial. So we know a couple different things are involved. We do know it's a combination of physical factors, such as structural brain abnormalities, genetic factors. So if one person in the family has schizophrenia or mental illness, it does increase your risk. Psychological factors can also influence this. So if someone experiences a stressful or traumatic event, as well as environmental factors, and this can include substance abuse or even birth complications.
What are some of the treatments for mental illness, and can you talk about opportunities for people with schizophrenia to lead stable lives?
Sure. So treatment also is multifactorial, and we like to take a multidisciplinary approach. So the first thing is a class of medications called antipsychotics, and this can help reduce both the intensity and frequency of the symptoms. We also look at perhaps case management, so people to help people with mental illness with daily living skills or just daily living supports. We look at supported employment. So it is possible that people with schizophrenia can hold employment opportunities and have the right support system in place for that. We also look at behavioral skills training, so they know how to act appropriately when around others.
Psychiatric Nurse Practitioner Tiffany Pottkotter. Tiffany, thank you for your time.
Thanks for having me.
Our temperatures are on the way.